you're not looking to implement IT for the sake of IT, but we're looking to implement IT upgrades that are required to maintain security and the infrastructure and be able to maintain availability of the patient's charts and other things so that they can continue to treat their patients without having to give any second thought to any of their IT tools.
Welcome to the Risk Never Sleeps podcast, in which we learn about the people that are on the front lines delivering and protecting patient care. I'm Ed Gaudet, the host of our program, and today I am pleased to be joined by Rebecca Kennies, the Chief Information Security Officer at Arnot Health. Or is it Arnot?
Arnot.
Okay, great. Excellent. Well, welcome. Let's start off with telling our listeners about your current role in your organization.
Right. Yeah. Thank you for joining me. I appreciate the opportunity. So I am the CISO at Arnot Health, and Arnot Health is I want to say small to medium sized organization, small health system in the Elmira, New York area. And we are made up of 3 hospitals with a total bed count of right around 400 and 51 outpatient medical practices of various specialties. We have skilled nursing facilities and a graduate medical education program. And my role at Arnot is really to try to protect the organization from cybersecurity risks and other information security risks through the physical security as well as cybersecurity.
And you've been busy, I'm sure, the last couple of weeks, to say the least.
Busy all the time. If you're referring to like any of the like the Change Healthcare and all of that, we luckily were minimally impacted. Which we're one of the few.
And it's great.
Yeah, we were not directly impacted. We didn't have any contracts directly with Change Healthcare. Some of our third parties to Change Healthcare. So, a little bit of downstream, but not a whole lot.
Great. Any learnings or anything you could share with listeners as to maybe why you weren't impacted? Was it much more of a? Did you take much more of a?
Well, it was more. I mean, not really luck, but just that we had a different vendor that we used. We didn't use Healthcare. Okay. So yeah. So unfortunately, I would like to take credit for that, but no, that one's not on me.
Did the incident cause you to pause and maybe take a look at your current approach and maybe do anything differently than you've been doing?
Oh, absolutely. Anytime you see any kind of security incident like that, it always makes you pause and go and look at your own practices and say, okay, is this something that we could be impacted by? I mean, and I won't say that we weren't at all impacted. We still had to go through and verify that, did we have any contracts with them? Because they have a number of different services that they provide and toolings that they have. And we did have one contract with them, but it was not for anything that exchanged PHI or anything like that. So, but yeah, one thing that we did take away from this was really looking at our vendor management processes and our contract management. Well, you want to make sure that it's easy to be able to identify, do we have a contract with this vendor that is having this issue, and be able to identify that quickly, because if you do, then you want to make sure that you're going to cut off all ties to them so that, nothing's going to impact your organization directly. And then what happens operationally beyond that as well. So there was, we did have an incident command center to make sure that there were not any operational impacts and all of that. But that was relatively quickly determined that there was not any instance for that.
I imagine that must have brought in a lot of other functions, legal, compliance, audit, contracting, supply chain.
Oh, yeah, absolutely. Yeah, the entire organization gets involved with that. You want to make sure that from the financial perspectives, from clinical perspectives, from the technical perspectives, and, obviously compliance legal as well.
Right. Have you been, just change topics here, have you been following the HHS cybersecurity performance goals that were announced last year and that are going through the rulemaking process now? And
Yes. Yeah. Keeping a close eye on that. And it's very similar, I would say, to what New York State is looking to do as well for hospitals. So there's a lot more regulations that are coming down the pipe, which, some I think is good and some is probably challenging. I think a lot of it is in the way that it gets implemented.
mm-hmm.
It's not a bad thing necessarily to have the low bar in the say of, what you should be doing. The challenge then becomes when you have, small to mid-sized organizations, finances are always a challenge. I don't know any health system, or honestly, any organization anymore that, is looking to spend money, and has extra that they're looking to do it for. So hospitals really want to make sure that they're doing the right thing. But unfortunately, a lot of times it comes down to what do we do for clinical care versus what are we doing for IT and other types of things. So, there's a lot of those decisions that need to be made. And, IT is not always the first thing that gets looked at because you want to make sure that you're directly being able to treat the patients. So part of my job is to help leadership understand that you're not looking to implement IT for the sake of IT, but we're looking to implement IT upgrades that are required to maintain security and the infrastructure and be able to maintain availability of the patient's charts and other things so that they can continue to treat their patients without having to give any second thought to any of their IT tools.
Yeah, that's great. Really, really pulling in the business requirements and the business processes. And I noticed you had a background in clinical from some of the earlier jobs that you had as an analyst. And I was wondering, any insight that you've learned over the years, and for those folks that are in security and trying to maybe establish that relationship with a physician or clinical leadership, any tips or techniques that you'd suggest?
Well, so I worked in healthcare IT for 30 plus years. I am not a clinician. I was never a clinician, but you learn to understand clinicians the more that you are around them. I worked very closely with one of the health systems that I worked with the physicians specifically.
Mm-hmm.
And you really need to be able to meet them where they are. And you want to make sure that whatever you're implementing, whatever security controls that you're implementing, that you're going to present the least amount of friction for them as possible, because their end goal is they want to be able to treat their patients. They don't want to have to care about, my concern is, their concern is not immediately whether the data is going to be breached or not. Obviously they don't want that, but their immediate concern is I need to treat this patient. And in certain cases, it's literally life and death. So, you want to make sure that you're not presenting obstacles in their way. So whenever there are things that they want to do or need to do, and, your first instinct might be like, let's not do that. You don't want to just come right out and say, no, you can't do that. It needs to be a conversation of what is it that you want to do? Let's see if we can come up with a better solution than that one that will work for both of us.
Yeah, that's great. So as you think about the next 12 to 24 months, what are some of the top priorities that you're currently managing?
Yeah, our top priorities right now are, third-party management. We're, looking to lock that down a little bit more, getting some better processes in place, and, ensuring that we are, trying to take it, I guess, beyond just giving the vendors an assessment to fill out. because of course they're all going to fill out, yeah, we're doing great. I mean, nobody would have ever imagined that Change Healthcare, this huge organization, would have, these issues. But the thing is that every organization has the potential to have issues if in the right circumstances. So that leads us to the people. So we're looking at ensuring that our training and awareness programs are strong. We've got monthly phishing campaigns that go out to our staff. We're doing monthly, small, fun, short trainings for everybody so that they're becoming, trying to keep at, 8 minutes or less. We don't want to make it anything that is a major project for them to have to do. But we also don't want to do the once a year. Most organizations do you're training them when they join the organization. You're training them once a year, with all the mandatories. And I will guarantee you nobody remembers anything after they finish it because they're checking that box. They need to finish it. You want to make sure that this is upfront, like foremost in their minds of what was it that you're trying to get across to them. And really what you're trying to get across to them is to be cautious when they're receiving emails, when they're getting phone calls, when they're, seeing somebody come in to try to get into a security area, all of that kind of stuff to make them just stop and think, just pause. Because, the bad guys, they work off of emotion. They're trying to pull on your emotion, trying to get you to react without thinking about it. So you want to give people the tools, give them that comfort level to know, all right, I'm just going to stop and think about this for a minute.
Yeah.
Give them, what are those signs that they can be looking for? Is it urgent? Is it unexpected? Is there a link to click on or something to download in there? Are they asking for sensitive information that they really shouldn't be?
Right.
So, to kind of give you those situational awareness to look at the question for that. So that's another big component of what we're doing. And the third component is, along the same lines with the vendors and all that is, one of the reasons that an organization gets vulnerable is because there's constant vulnerabilities that are being discovered, and that whenever you have an upgrade, there's more opportunities for there to be a bug in there that's going to make a hole for somebody that's accounted through. Right. So you just need to make sure that those vulnerabilities are being mitigated in a reasonable time frame. You want to make sure that particularly anything that's critical, anything that's currently being taken advantage of out in the wild, that those holes are being plugged, as soon as you can. And, there's challenges with that always, because whenever you're upgrading or whenever you're doing that, sometimes you have to take down the server, and you have, particularly in healthcare,
you're right.
You get the areas that are like, well, we can't have any downtime. It's like, okay, I understand that, but either we have a small downtime now, or we're going to have a huge downtime at some point in the future, because either the system is going to crash.
Limited downtime.
Right. Either the system's going to crash, or we're going to end up with, we're not going to be able to take care of these vulnerabilities, and we're going to end up with some sort of a breach or ransomware or something.
Right.
That's what words I want to ever have to say.
Yeah, no, that's a great point. You got to, and I love that notion of continual training too. That's reinforced, because you're right. That one and done or that annual training just isn't enough these days. We have to create that culture of vigilance, if you will.
Well, and that's exactly it. What I'm really trying to do is build up that culture of security. To make it more the norm, the staff are going to be thinking about and taking into consideration, is this really a good idea? Because, you put controls into place and people can find ways to get around them. But you want to make it so that they have that understanding of why are these controls being put into place? We're not here just to make your job more challenging. we want to make things better and easier for you. You don't want to make it more challenging. So they need to understand that big why of why are we doing it? Once a person understands the why, the what can follow. But until then, they're not going to get it.
Yeah, it always makes sense to start with the why. Where does AI fit into all of this? You hadn't mentioned that, and I'm just wondering how are you managing that?
Yeah, so AI is one of those things. It's it's the big buzzword now, and there's been there's definitely a lot of good use cases for AI. We are right now still evaluating what we want to do, and of course AI means different things. It has been around for years. It's just most end users didn't recognize it because it was built into
It was deterministic. It was rule based, and
right. But now, with the new Chat GPT and all of the other generative AI, that's where it's becoming much more available to just anybody. And we've had not a lot. We've had some requests to allow the use of some of the generative AI for documentation and charts and that sort of thing. We started with the policy. Yeah, we created the policy. And one of the big things with the policy is that we need to make sure that first we're going to do no harm. First we need to make sure that, one, is it a good source of generative AI? Is it reliable? And is what it's going to produce going to be accurate? So you want to make sure, first of all, especially if it's going to be something that's going to be impacting a patient's chart, that you're going to have accurate information going into there. So, and second thing is it secure? You have to obviously worry about privacy. Where is this data going to be going to? Is it, do we have an account with them? Can we have a business associate agreement with them? Can we do an evaluation of how they are treating this data? But it's starting, first of all, with the clinical leadership and having them evaluate it and say, is this something that we want to do in this circumstance? So before IT, before security even looks at it, we're saying, okay, well, has the CMO signed off on this? Has the medical director of your area signed off on this? Are they approving this? And then once we get that approval, then, okay, we'll look at this. But what we do want to do is get to the point where we're going to have more of a standardized approach to it. So that if they agree that they want to have the generative AI documentation tool, this is the version, this is what we're going to be using. We're not going to be doing that onesie, twosie, okay, I saw this, hey, I saw this. Because number one is that, it's a lot of excess work. It's a lot of excess risk. And, on the security standpoint as well as the output. So you want to make sure that all of that is valid.
Many folks I talk to have created these governance structures and committees. Have you done that as well, or
specifically for AI?
Yeah.
We're not to the point yet where we have an AI governance structure. But with our policy, if we have, the policy says that it needs to first go through the clinical and or the business area. And then from there, we have a privacy committee, we have a compliance committee, and an ethics committee.
Stage gates that you go through.
Right. So at this point, we don't have one overall AI committee, but it's going through a number of other hurdles.
Yes, I like that. It seems more streamlined, quite frankly, than...
I think so. And, why make another full committee?
Right, exactly. Well, I think it took everyone by surprise and they didn't know how to deal with it. Like, well, we got to create a committee and get cross-functional. That's certainly one way to do it. But I know your approach is very streamlined and treats it more like just another technology that's coming.
Right. Exactly.
I love that. What keeps you up at night? Obviously a lot.
what doesn't keep me up at night?
I know.
Honestly, I sleep like a rock because
you have a great team.
I do have a great team, but I don't sleep like a rock because I'm not worried about anything, but because I do a lot of worrying during the day. Mm-hmm. So, it's always the unknown. You can put together your fortress. I like to use the analogy of like a castle with a moat and with the armed guard, the armed guards that are out there in their armor, 60 armor and all of that. You have all of your firewalls, you have all of your MFA, you have all of the other technical tools that you're using, your SIMs and your SOARs and all of that. We can do all of that, make sure that all of our vulnerabilities are good. But it literally takes one person
to click,
having an off day that clicks on a link.
So true.
So that's where it's so important to build that culture of security so that if somebody does click on it and then they realize that, oh my gosh, I probably should not have clicked on that. That they're not going to be afraid to let us know, that they're not going to kind of just say, well, let's just pretend like that didn't happen and nobody will find out. We're constantly encouraging them, let us know as soon as possible. We can try to mitigate any issues that happen. You're not going to get in trouble for making this mistake. I promise you won't. If we find out later that you did this and you tried to hide it, no promises on that. But you want to make sure that, that there's that trust, that, that they can trust us, that we're going to be acting in good faith for the organization, what's best for the organization, and not be punitive about it.
Yeah. Yeah, that's great. So I don't think I asked you this question. How did you get into healthcare and IT?
Yeah. How did I get into healthcare? I got into healthcare backwards. Let's say that. So my undergrad was in mechanical engineering. Mm-hmm. And I graduated at a time when there were a lot of layoffs. So I did not have a job right out of college. So I got a job working on the lab system at our local health system. Mm-hmm. And it grew from there. I went in there thinking this is a temporary job while I'm still looking for my real job. And, opportunities presented themselves and I came to love it. I came to love working with clinicians. I came to love working with teams and just doing kind of like the moon landing, the janitor saying that I helped to put the man on the moon. I'm doing that as well, implementing EMRs, making sure that things are safe and secure. So, here I am 30 plus years later and, still there.
Yeah. No, that's a great story. And I think that background coming out of ME, you had that curiosity too, right? So that really enabled you to get into IT pretty seamlessly.
Oh, yeah. Yep, absolutely.
That's great. Outside of healthcare and IT, what are you most passionate about? What would you be doing if you were doing this job?
Oh, my family. I'm very passionate about my family. Mm-hmm. I am also an avid Buffalo Bills fan.
Oh, so, okay.
Yes. My husband and I went to SUNY Buffalo the year that we went there, the year that Jim Kelly.
Yeah.
Yeah. Became a card-carrying member of the Bills Mafia then. And so.
That's great. My favorite poet was, I think, taught there, Robert Creeley. And the name ring a bell? Was in University of Buffalo, maybe. So
yeah, that's where we went to.
Yeah. Cool. So family, any hobbies or anything that you do outside of this?
Honestly, I love a good book.
Mm.
When I like to just like kind of turn my mind off from everything that's out in real life and just fall into a good book and read. And honestly, this time of year, and I'm not quite there yet, and I'm itching for it, but I'd love to just float in my pool.
Yeah. Me too. With a book. I said, I'll bring my Kindle in there too. And it's like, don't drop the Kindle in the pool.
Even better. Yes.
Exactly. That's great. If you go back in time, what would you tell your 20-year-old self?
I would tell my 20-year-old self to just roll with it. Everything's going to be okay. I've always been a little bit of a worrier. I guess that helps a little bit in my current role, but
sure. Doesn't hurt.
And always a bit of a perfectionist. So I think I would tell my 20-year-old self that, you know what, everything's going to be okay.
Mm-hmm.
You're going to do great things and just be patient.
Excellent. I have to ask you this question. It's the Risk Never Sleeps podcast. What's the riskiest thing you've ever done?
Well, it probably will not surprise you to know that I do not have a high tolerance for risk. I've never really been a very risky person. I think probably the biggest risks that I've taken were just kind of the leaps of faith into new roles. Mm-hmm. And, sometimes kind of going in and saying, am I really ready for this? I'm leaving this role in this organization. The things that I know, moving into a new organization, a new position, new responsibilities. And with, kind of just taking that leap of, I can handle this. So that's probably as risky as I'm going to get.
That's pretty risky though. It's you're constantly driving yourself into embrace your dread, like embrace the newness of something that you really don't know or understand. That's a huge risk.
Yes.
I love that answer. All right. I think we'll get some time. I'll ask you a couple more questions. So you're on a desert island. You could bring 5 albums, CDs, or 5 movies with you. What would they be?
Long.
It doesn't have to be 5, but
okay. So movies, I'm going to say just about any Adam Sandler movie. I can watch them over.
See that coming.
That's my husband and I are big.
That's great.
Big Adam Sandler fans. Gotta love that just stupid humor.
Yes.
Some of them, there's a couple of them that probably would, but most, just about any other Adam Sandler movie. I can watch The Wedding Singer over and over.
Great soundtrack too. Wedding Singer.
Yes. Well, and honestly, I was going to say that would be one of my CDs that I would bring too, as a Wedding Singer.
Yeah.
The 80s music.
Yeah, I love it. Yeah.
Yeah. Also, Queen. I'd bring.
Nice.
Yeah. Queen music.
Which do you know the album or Night at the Opera? The one with Bohemian Rhapsody?
If I had to choose one, I would probably have to choose one of their greatest hits ones because there are so many good ones. And which one is like maybe one of those double albums that I can fit most of them into?
Love it. You're thinking about the island.
What was that? And then just to throw things up a little, I would probably bring trying to think which one. I do like some Broadway stuff too. I like Broadway shows. Probably Come From Away is probably one of my favorite albums from that.
Yep. Okay. Check that one out. Awesome.
I have a little bit of everything.
Nice. I like it. Last question. What advice would you have for professionals that are they want to break into healthcare or IT or cyber? What advice could you give them towards that profession?
So my advice is to just do it. If you're interested in cyber, take a class, look online for some tutorials or something like that. And it doesn't have to be only on the technical side. So information security covers, obviously the cyber realm, like with all of the technical pieces and tracking the codes and the hash and all of that. It's also making sure that you have, you understand the requirements, the governance, the risk management, the compliance, and you have to know some of the language on that. You have to be able to speak that language, but if you're interested, just do it. Talk to somebody, take a class, just do it. Don't feel like you can't do it because you haven't been immersed in servers and networks and firewalls for all of your life. I honestly, my background is not in the technical side. My background is in the operations, in the application side.
Mm-hmm.
So I came into information security from the background from there as well. And you learn as you go. And just, if you want to learn, just do it.
I love that advice. We have a customer that uses their third-party risk management program to onboard, newly graduated students into risk management. And that gives them this purview of all of the business aspects of cybersecurity, as well as the technical aspects. They basically will do a stint for a year, and then they get to pick where they go next. And a lot of folks are moving, and so I love this idea of, getting, like you said, go in as an analyst, go in as an assessor, learn. You can learn a lot from that perspective and then decide where you want to go from there.
Oh, right. Exactly.
Yeah. Love that. All right. Well, thank you, Rebecca. This is Ed Gaudet from the Risk Never Sleeps podcast. And if you're on the front lines protecting patient safety and care delivery, remember to stay vigilant because risk never sleeps.